There comes a moment when you've exhausted all your options while simultaneously coming across a product that reinvents your notion about what an honest and high-quality company looks like. The Healing Rose was the catalyst to that very moment for me. The Healing Rose Company is a female-owned Massachusetts CBD company based out of Newburyport that prides themselves in using only the best USDA-certified organically sourced ingredients for their vast line of therapeutic products. Their line stretches from lip balms, tinctures, skin balms, roll-on oils, and bath products. Their transparency places them above the rest with third-party tested results showcasing their intolerance to toxic pesticides, solvents, metals, and harmful elements. They provide full-spectrum CBD in many of their products, excluding their tinctures, which carry a broad spectrum profile, ideal for not having to worry about any low-level THC, which is common for many CBD products. That one's my favorite, and it's good on the palate. Full spectrum means that they extract from the hemp plant an array of different therapeutic cannabinoids along with CBD and their profile terpenes. The combination results in a greater outcome of healing and relaxation for any individual's needs. Whether you are an athlete looking for any recovery advantage, a patient in need of some relief to remind yourself that you are still a warrior, or someone who sees the frontiers of life with a little reserve and want to calm the mental storms that keep you from personally exploring, the Healing Rose CBD Company is here for your full body and mind optimization. Please visit thehealingroseco.com to explore their diverse line of products and support one of New England's best rising stars in an industry where ethics are fundamental, and a company like this will only be found sitting at the throne of it all. Use the code SAGAS, S-A-G-A-S, for 10% off your purchase. Again, visit thehealingroseco.com and use the promo code SAGAS at checkout for 10% off your purchase. To the many martial artists, entrepreneurs, dreamers, and thinkers, how often, for your own sake, would you love a symbolic reminder of your mentality and the perfect dichotomy to match? Murder Nerd is an independent clothing apparel line that represents the sharp, relentless focus towards personal growth and athletics. It embodies the vitality of their creative owners and the network of people who run on the same frequency. Why not elevate your frequency in comfort and style? Visit www.murdernerdsfitness.com for their personal line of shirt and hat wear. Enter the promo code SAGAS, S-A-G-A-S, for 10% off your purchase. Again, visit murdernerdfitness.com and enter the promo code SAGAS for 10% off your purchase. Okay, here we go. All right, so this one's kind of been in the pipeline for a little while, and man, these always get me nervous. These get me nervous because of just how much detail is within this conversation that, you know, I never feel that I'm equipped to truly understand, or never mind be somebody that actually should speak about it, right? Because I don't want to do a disservice to the real situations that should be questioned, real authority figures that should be put under a much more stringent scope. I also don't want the risk, obviously, of being associated, as I've said before, with a certain type of thinking that kind of just is a symptom of a mind that grasps for straws when your back is backed against the wall. You know, and never mind just how much I feel like I have to prepare for this, because it's like, I feel like I'm fucking like a defending lawyer here, trying to make a case for something, but, you know, here we go. We're going to go with this, And I'm going to do my best to go over something that I know is a little bit controversial, and you do what you will with it. And it's only gotten to this point because I've seen things over and over and over again, and things start to really fucking get under my skin with stuff like this. And all in all, I think this is actually going to turn into maybe a two-parter. One that's a little more of the technical, circumstantial explanation, and the other one that might kind of bleed into a little bit of a, I don't know, maybe a philosophical, psychological aspect to this first part. And what we're going to go through is the Food and Drug Administration, which is a big one to tackle and a weird one to even talk about, because the thing is so big, and the labyrinth of information that gets funneled into this organization and what they have to do is like, it seems daunting, right? But when it's something this important, yeah, then there should be good resources within that to be able to kind of handle the, what would you call it? The workload, I guess. You know, and also when it's this big, everybody should really kind of be aware of what's happening and what's not happening. And I think my biggest problem with this thing is like the effort of maybe transparency in certain corners of their practices. So let me just get into this. So like the first time this really came to my attention was, I'd say maybe 2 years ago. I'd say about 2 years ago, when you know, obviously things kind of hit the wall, or hit the first wall, with my wife and kind of her situation. And why I was looking into stem cells, mesenchymal stem cells, is because of, obviously it falls under, it's probably the head of this umbrella therapy of regenerative therapies, right? You have stem cells, you have platelet therapies, you also have Jesus Christ, the PRP, which I know is part of the platelet therapy, and a couple other ones that kind of fall underneath that. You know, and obviously these things are never kind of, a lot of times they're not covered by insurance if you want them, but, you know, I was looking into them because of the regenerative properties, how it helps with a lot of different connections when it comes to peripheral nerves and then the nervous system itself, right? There's a lot of crazy stories and situations that have been studied, mostly outside of the country, about how it's helped a lot of different autoimmune problems, neurodegenerative problems like Parkinson's, ALS, you know, and the kind of the list goes on. Some people try it for Lyme, and you know, and looking into it, a little bit of the problem was like, all right, well, say you did have the funds to be able to do this. Where do you go and who do you talk to about this? Because when I started looking into it, it's all, what would you call it? What's the word? Orthopedic, right? It's all orthopedic work, which means like you can only do it to certain like your muscular skeletal system, right? You got something wrong with your ankle, you got something wrong with your knee. This is what some of these places do, or use stem cells for, are a lot of sports injuries, knee injuries. And some of the things that you can do on a very limited basis here is to use the stem cells you can derive from your bone marrow and then retransplant them back into you in an infusion process if you have certain types of cancers. And those are very powerful stem cells, and the whole point of not the point, but like an aspect of stem cells to make the efficacy better is you have to culture them, you grow them, and you can replicate and duplicate your stem cells so that when you get the infusion back into you, you're loaded with that much more, so that it covers more systemically. And that part of it is what makes it hard, because you can't do systemic therapies in the United States. You can only do things for the knee or for the shoulder or whatever that is. And I'm like, all right. Because the thing is like, yeah, you can have problems with neuropathy for your feet, and let's say that the stem cells do call on all these different growth factors and send out the signals to create like this turbo process of repair, which is what you're looking for, because the body is already in a mode of wanting to regenerate. It just ends up happening slowly, or just not fast enough, can't keep up with the cause of disease, because that in itself is ahead of the regenerative process you naturally make, because that's why you're degenerating, I guess. And it's like, okay, you can do that, but if you don't know what's causing that, then it's also just the most advanced, Band-Aid you can use. So you would contemplate, well, I want to use this systemically. I want to see what it does to antibodies and autoimmune processes, and what does it do to your complementary cascade system, which is like a huge regulator of your immune system, and where things can get out of whack and all this shit. So I'm like, okay, well, where can I go? Oh, you can go to India. Well, I don't want to go to India. All right, we can go to Mexico. Well, what do I got to go to Mexico? And then the list goes on and on and on, and it brought me to this place in Panama. Between Mexico and Panama, you can get systemic infusions of stem cells. And the process was long, and looking for different offices. I mean, I made phone calls. I was on the door. I was talking to the Stem Cell Institute in Panama, which is a world-renowned place that a lot of people go to, even for orthopedic processes, because of what stem cells they use. And because what they do there is it's all regulated through using donated stem cells that you get from umbilical cords from a lot of mothers who give birth in the surrounding countries. So they go through this entire filtration system so that everything is pure, everything is, kosher to and safe for you to be able to get this therapy. And they don't offer that in the United States. In the United States, you actually get adipose tissue taken from parts of the belly, usually parts of the belly. And what I mean by that is you're pretty much getting a very mild, small liposuction, because you have stem cells in your adipose tissue, fat cells. And then as you extract them, you culture them, you try to grow them, and then within a day or two's worth of kind of culturing, you get it re-injected in your joints or whatever. But they won't do it systemically here. So there, they can do it systemically using another source. And I'm like, okay, and it's like, it's not an easy thing to say, yeah, let's drop this amount of thousands of dollars for the trip to go and do this. Especially if you're not totally sure about it. And if all of the literature is all outside of the United States, because regulatory bodies allow for certain therapies outside of the United States that the United States doesn't. So you're like, well, yeah, because it's trying to keep us safe, right? I mean, we are the greatest fucking nation in the world. Why would we have below par service when it comes to certain types of modalities and therapies and all that stuff? You would think that. And yes, absolutely. In an acute situation where I get my fucking hand cut off or something happens in a car accident, I don't want to be anywhere else other than this country in an ER, because they're unbelievable. But it's hard when, if you suffer from something that's not that urgent and it's debilitating and doesn't go away, it's hard not to question, like, well, where are the resources for this, and why the thing that I want to try is so difficult to try, when some of these things should just be left up to my own decision, within my own autonomy, and my relationship with my direct care team, I guess you would call it. And so the more I look into this, you know, I want to jump into other things, but it's like, you find out that the FDA classifies stem cells as a drug. And just on the surface of that, it kind of doesn't make sense to me and to a lot of people, where it's like, well, this is more of like a biological that you can actually get done easily in a regulated clinic. So why would you call something a drug that comes from me that I can put back into myself? And, you know, you can have a system in place where you are liable for your own health, depending on what procedures you do. And the problem with that is that classifying something as a drug creates an entire obstacle of trying to get something approved. And yes, you would say, well, it takes 10 to 15 years to get things approved in this country, and it's wonderful and it's great. And the thing is, it's not consistent, because some things get thrown through that, and it's an entire story in itself, but some things get thrown through without good regulation. Some things get over-regulated. Some things take way too long to come to market, when you have other countries that have half of the amount of time it takes for clinical trials, 3 phases, all of that stuff to go through. And it's like, it's not, how do I say this? When you put it in as a drug, it's going to take for fucking ever to actually get anything going for the market to be able to take advantage of. When it's my body, you're taking it from me, and I'm putting it back into myself. So why do I, what? When there's already literature, but we don't want to go by some fucking third world country literature, because that's how we see the medical system in every other country. And, you know, it just takes that much longer to get more of a diverse pool of therapies and medications on the market. Because you can say that the longer it takes, the better it is, but what we don't realize is that when something is going through these clinical phases, it's like your first 3 years, 3 to 4 years, that can really be where the science lies, where the data collecting is, where the demographics of people come into play, and how you get the data from them, and then the follow-ups, right? So much time is invested in so much time is invested in how we get a drug to market. You know, there's a standstill sometimes with some of these drugs and methods, because we want to be able to patent these things, and it can almost take 5 years to get just a company to mock up a contract to be able to put it on the market. So there's more time that people are waiting for shit that could potentially actually help them, that's all fucking gobbled up by which massive fucking tycoon company is gonna profit off of these things. And yeah, okay, another fucking thing to bitch about money and all this stuff and greed, but it's true. It's just, it's too bad. I don't want to, it's like, I want to say this without sounding like it makes no sense, but I don't know how else to say it, because I have to divorce myself from the reality of the thing. But it's like, it's weird to step back and know that everything to keep you healthy in this sentient life is monetized to a great degree. And in that monetization of every single mode of therapy, everything you put in your mouth, it creates a very squirrely system that can be taken advantage of. And then in the end, it doesn't get the thing itself to the people that need it the most. And it always comes down to that. Because obviously, we need to pay people for their time. And if you break down the whole process of making a drug, that's what it is. Paying people for their time, and then, never mind, who gets to be the judge as to how you profit off the thing itself once it actually makes it to market. And how much people get. And that whole thing bogs down the last phases of this whole fucking 10-year process just to get some, who knows what, some fucking new statin, whatever the fuck you want, some new depression pill. And it's like, alright, well that's kind of shitty. And never mind that they actually start bullying clinics that want to further their stem cell research and therapies for their patients, and they start bullying them and threatening to send them, the fuck you want to call it, subpoenas? Fuck, I don't even know. But they threaten to shut down clinics, very reputable, good clinics with people that have PhDs working there, all of that stuff. And it's just fucked up. So I'm like, all right, yep, just another thing. And so I move on. It's all you can do is just move on. You move on. That's on the back burner. And then one after another, I keep finding all these instances where just something gets in the way of something that doesn't make sense. And then you start to question, like what's happening here? Who's making these judgment calls, and who gets what by implementing these judgment calls, right? A real quick one, and I know everybody, this is another controversial one. I'm just so tired of just how everything is so controversial. And I do kind of get it, because it's like, as I've said it before, information doesn't give a fuck who knows it. So sometimes some people that know it, even if that information is true, you're going to get a demographic of people who are fucking weird. And then they end up being the weirdest advocates for this thing. So then the rest of society is like, fuck this shit. Do you see, Crazy Samantha talking about this? Like, yeah, sure, go ahead. And then they just kind of dismiss the whole thing because of the bad representation. But another one was like, all right, what is this mercury thing? Because, listen, I am going into every nook and cranny to see what I can find as an advantage to try to help my wife. Because when something is unexplained and you have idiots saying idiopathic about everything, you just kind of have to dismiss these people and try to figure out something on your own. Because things don't come from fucking nothing. They don't. And it's a fucked up system where it's all about time. And if you don't have enough time to actually figure this out, or to be creative in your science, you're going to be pushed aside easily, and they're going to label you as something that they just can't figure out. So anyways, this is why I have a vendetta for a lot of these things, or towards some of these things. So I'm looking into mercury. I'm like, all right, wow, that's pretty heavy. Yes, that can be very, that can go undetected for a long time. That's a weird symptom. That's weird. Oh, if you eliminate this and that and this and that, these people are getting better. Wait, you can get rid of certain types of fibromyalgia from what? Taking out the 2 amalgams you had in your mouth that you've had for 20 years? Bullshit, this can't be real. And then it just spirals, and you go into it. And then one of the most prominent people that I discovered in this was another PhD, NASA. What is it? Biologist. No, chemist. Fuck, I can't remember. But his name was Andrew Cutler, and his whole thing that he looked into was the idea that mercury in small amounts that have not been addressed, in the sense that small accumulative amounts can actually change systems in the body, are actually doing the damage that you're seeing in a lot of these people that they don't know what the fuck is wrong with them. And it comes through the leaching that can happen in the amalgams in your mouth, right? They used to stuff these things in our mouths in the 90s like it was nothing. And now all of a sudden they want to take them out and put in these nice clear compounds in there. But don't want to tell you that, well, yeah, it's because this shit is fucking toxic to you, right? This is why some dentist office have a certain protocol when they take out your old amalgam. They have a vacuum set up in your mouth. They have a vacuum set up in the room. They're dressed up like they're fucking cleaning up coronavirus on the streets. Masks, suits, goggles, everything. Because of how dangerous when you take out an amalgam can be, because of all of the particles that are flying out of your mouth when they're actually trying to remove these things. Because, you know, it takes a bit to get that shit out. And it's like, all right, we're dressed like post-Hiroshima, so why'd you put it in my fucking mouth in the first place? And there's documentaries, there's lawsuits, all about how certain things have come, even like a lot of very heavy MS symptoms have come from the abundance of mercury in somebody's mouth. And you see when they chelate, which is another term for extracting these metals from your organ tissues, your serum levels, all of these things. It's because they can stay in there and they start to make a dysfunction in your... Take it easy, kid. They start to make a dysfunction in your organ function. And, chill. My goodness. So they start to make a they start to influence the way things function, and this is how you become symptomatic of it. And yes, lots of people have these in their mouth, right? But yet again, it's like a lot of other things. Just because a majority of people don't have a problem doesn't mean we can't look into a better way of doing something, because it is hurting a lot of people, right? Because if we just had that attitude towards everything, you wouldn't have dairy-free cheese. You wouldn't have, what the hell is it called? Lactate milk. You wouldn't have gluten-free bread. You wouldn't have peanut-free protein bars, whatever. Because some people are sensitive to very specific things. And it's incredibly detrimental to their health. I parallel it just like that to food, right? Some people can't have nightshades. Some people can't have fucking whatever. Tomato sauce. You know, it's brutal, and that's a whole different conversation in itself. But we can't dismiss the good-sized demographic of people that are suffering over this shit. And the whole reason I bring this up is because, yet again, as this gets reported, as lawsuits go through, there's no accountability from the FDA. When then the FDA, when you look at the rotation of the different people that are on the FDA's board, you see how they benefit from certain industries. And one of them, who was the head of the regulatory body for dentistry, fucking totally in bed with a distribution company that actually distributes the amalgam compounds to all the dentists. Right? Never mind the massive amount of lawsuits that if you could trace back your symptoms to having amalgams put in your mouth, it would just flood that entire organization. And we still put that shit in people's mouths. And you know who gets it? People on Mass Health, right? Yet again. It's cheap, so fuck it. We'll just give it to people who can barely afford anything better. Can't get rid of them, right? You can barely be in a room with a certain amount of mercury. There's regulations to it. You can ask any coding person who looks at like an industrial site, anything like that. And we put it in our mouths, man. It's crazy. So I'm like, all right. And the reason it pisses me off, because when you find out that this is real and this is true, and that there's a way you can help yourself, that way is never easy. It always costs money. It's never covered by insurance yet again. More shit that keeps you from getting better because a certain regulatory body doesn't want to help you, at least in that way, right? You're one of like fucking 500. Doesn't really matter. Everybody else is fine. We're not going to change an entire system just for that. So it's like, all right, there's that. And then, after that, it just kind of gave me a huge question mark as to what is happening here. And when you finally start trying to dig as objectively as you can, it's like, there is no regulatory body that regulates the regulatory body, right? You have all these board members, which are all physicians, and they end up, what the hell is it called? These people end up getting paid by certain companies for their lectures, for their travel, for all of these things. So it really comes down to a conflict of interest. Because it's something called pay later. Pay later conflicts of interest. Because as you go through the process of getting something passed, using the research through universities usually, and then having the pharmaceutical company run their own tests through the clinical trial, using the arm of the university, you can cherry pick any end result study you want. If you have 10 studies and they're all funded by the fucking company who wants to sell you the thing, if 4 of them come back positive and the good efficacy, they can not show you 6 of them that didn't work out very well or didn't work at all, or they were bad for you, right? This is the problem. And you can see this, and it's shown to happen, that they can cherry pick all of these things. So you're not getting the full pool of data. And in a weird way, you can kind of see it, because every fucking pill either gives you diarrhea or a migraine or death or suicidal thoughts or a skin rash. Everything, every single thing has something. And yes, I understand that maybe medications aren't always going to be pure, but that's just even that in itself, what I just said, is another part of this that for some reason we don't do. Because what you can do is you can take cells and stem cells from a patient, put them in a petri dish, and you create this environment where you use the compounds of a medication in combination with that to see how cells react. And you can do that for, let's say, 5 different medications. And if you do that pre-putting somebody on a medication, you can see right there in real time which medications are going to have some irregular reaction. No, which cells are going to have an irregular reaction to these drugs. So then the one that doesn't, boom, there it is. That's your winner. We know that when we give this to you in real life, in real time, that you won't have a reaction to this. But instead, we're like, no, try this. No, try this. And every time they say try this, it's 2 months of fucking not knowing if it's going to work, or trying to get through the bullshit fucking diarrhea that your metformin's giving you, right? Shit in your pants, hoping that this thing calms down and works. And then when it doesn't, you're back to square one and you're on your next 2 months of trying some new fucking medication. That process right there of using all these medications in a petri dish with your personal cells to see how you'll react, we don't do that. We could do that, but we don't do that. Right? Why would we do that? Gee, I wonder why. So, and there's There are so many details in this, and this is why this is a hard one to do, because I'm just giving you surface fucking angry shit here. And I know a lot of it's not going to stick, but it is one of those things where if you care enough, and either you get sick enough or somebody you care about gets sick enough, you will find this. Because everybody who's healthy doesn't give a fuck about this, right? Everybody who doesn't have a chronic issue, doesn't have a family who's about to get diagnosed with some terminally ill thing, like, they're not in this, and nor should they, right? But when somebody does say something and does want to surface some degree of corruption in this big of a body, then people need to listen, because everybody's fucking life has your number, and something's coming, and hopefully it's something minor, but something's coming. And I see it as something where if we don't all kind of get on the same page and listen to each other and actually all really become advocates for really good transparency in how we get fucking drugs, how we make them, how we don't get certain drugs or therapies, if we don't do that, then this just parallels everything else that's fucking going on, where we're at the bottom of the totem pole of all of these pillars of society, and we have no voice, because all of these powerful bodies get to do whatever they want constantly, right? And yeah, you get little signs of people kind of like getting together and really bringing about an idea and inserting it into the ethos of life, which is what like the Occupy Wall Street thing was. Whether you agreed with it or not, it at least gave you the idea of like, yeah, what is happening over there? And then, bingo, you get a real explanation of the 2008 fucking crisis with the mortgage and all of these things. Like, yeah, there's truth in how people take advantage of a system that you and I don't get to write policy about. You and I don't get to do any legislation over. We just get the fucking bread and circus game of, hey, vote for this guy and maybe he'll do something for you. And that's all you get. There's no real threat by any of us towards any of these things that's going to promote real change. And if you're not in the arena of healthcare or sickness, you could give two fucks, right? And that's most people. But Jesus Christ, I mean, the pendulum's swinging here. We're getting more people sick in this country than ever before. I can only imagine why. So, I mean, this is kind of, this is kind of where I'm at with this whole thing. And it's driving me crazy. Never mind the, Jesus Christ, what's his name? The Stanislaw Brzezinski case, where this Polish doctor somehow engineered this peptide protein combination called anti-neoplastons, and he was doing infusions for these children that had brain tumors, and he was curing them. Holy shit, the runaround this guy got. And it's a long, complicated story, which is why most people don't ever know this stuff or understand this. But the short of it was that there were powerful bodies coming together to try to undermine his work so that they could volley his work into the hands of the FDA through other organizations, all in the end to try to patent the technology, to hold on to it themselves or monetize it again. Because an independent doctor himself could never figure out how to help his patients without the arms of all of these different organizations. So for like 15 to 20 years, they brought this fucking guy to the highest level of courts, like 6-7 times. And it was unbelievable, the fucking smear campaign they ran this guy through. They even created websites and blogs and even Facebook pages in the early 2000s that are still around now, literally engineered to smear and undermine all his work, when all of those sites are actually part of a campaign to discredit everything that he does. They're not made from independent people who have suffered by the hands of this doctor. This doctor has saved fucking thousands of lives. And the whole thing was a runaround to destroy his name, destroy his career, all to take the technology. And what the fuck were they going to do with it? Were they going to use it? I don't know. But the heavy-handed way that they went after this guy, all while being okay for kids to get their fucking brains fried by chemo and not giving their parents the choice to try another therapy, all because they didn't even say it wasn't safe. They said it was okay. They said it worked well. Yet they still dragged him into the court system. It's madness. That story is madness. Dr. Stanislaw Brzezinski. If you look that guy up and you try to get past the 3 or 4 websites that are absolute bullshit, you'll find the real story in there. Of course, you're not supposed to find the real story, but you will find the real story in there. And yeah, of course, this is an easy place to say, yeah. It's easy a place to subscribe to the idea that, like, well, if you have a cure, why would you do it, right? You're going to dismantle an entire industry of jobs. An entire industry, right? But I don't think it's that simple, right? Cancer comes in many different forms. It evolves, right? And as it evolves, it's like, well, you can make money in evolving with the cancer, so that if you let people live up to 100 to 150 because of it, there's your money. You help people live longer, right? But if you look at the infrastructure of how cancer awareness works, it's a very big industry with a lot of people that have their entire life's career and family's well-being invested into it. I don't know. I'm not saying that we don't want to cure it, right? But it's like I said in the beginning, it's just transparency. They're so bad with their transparency. Tell us all of these things. Why are you taking money from pharmaceutical companies after the fact? Yeah, that was the fucking rant that I didn't finish. You go through this whole process, and these doctors on the FDA board get paid by the pharmaceutical companies after a drug goes through all of these different pipelines. And you can question them on it, and they will absolutely tell you that it's just part of the process, and that money will not influence the outcome of this drug through my decision. So pretty much shut your fucking mouth, because I'm the professional here. And there's nothing you can do about it. You know, and the whole two-parter thing with this is like, this is the whole ranty one. And what I wanted to expand on, and I'm going to, is like, what is this? What is the psychology? What is the social phenomenon of, like, conformity that allows for a lot of these things to happen, right? Nobody wants to kind of question certain things because of how we'll seem, how we'll look, right? And it's all these almost evolutionary mechanisms. The same, in my head I'm just guessing, but it's like the same little thing that makes you not raise your hand to ask the teacher a question, or to not have a conversation with your doctor about all of this bullshit, is the same thing, is like, why you're in the middle of the street and fucking Godzilla comes running up and everybody starts running. You just slowly start backing up, right? Everybody's running, right? Your instinct to survive, to not be attacked, to not have the mob come after you, to not get stepped on by Godzilla. I'm just going to go with the crowd. This is what's going to keep me safe. You run from Godzilla in the same way that you run from asking questions to certain aspects of authority. And I want to know what that is, and I don't know what it is. I want to question that. I want to question what is it that is dumbing down our ability to have a good, powerful, logical, reasoning intuition. There's something that we just don't believe in ourselves when we read something or try to understand something. We just don't believe in something that we're telling ourselves. And I see it echo into all of this shit. Yeah, you got to be smart about it. Your gut isn't always the fucking smartest thing. But a lot of times, just letting yourself have doubt over something is a healthy thing. And we just don't have that enough. And I want to explore that. Because if we didn't have that, I don't think you would see a lot of this shit rising the way that it does. And having control over every aspect of your fucking really shitty circumstance. Because when it gets really bad, you're scouring to see what you can do for yourself. And you don't have a lot of options. Whether it's because you're not fucking rich and you can't afford it. And two, it's because no one is allowing you to experiment with yourself. Where's your fucking autonomy? If I've come to the conclusion with my healthcare team that we want to try this, why are you not letting me do this? And then if it comes out well and it works well, why are we not allowing insurance to cover this, right? I never got into this before, but it's the same thing with ketamine. You see the levels of success with ketamine for just even depression, heavy depression, that will make you off yourself. And it's helping a vast amount of people. You can't get that shit covered. You better have cash, son. I want to give you a pill. I want to give you something else. I don't give a shit about your side effects. Take it. So I don't know. That's where this is at. And then, I want to get into the other stuff because I'm still kind of on this frequency. Because this is all just kind of very squirrely to me. And no, I'm not going to get into the vaccine and all of this stuff because all these different parties are into it. But, I don't know. Blood clots are just natural things, I guess. I don't know. All right, guys. Like it or hate it, that's what this was about. And it's just something I got to get off my chest. And I hope that some people are just aware of this, because if you are, it allows you to kind of ask the right questions, go in the right directions, try to find a way to trust in yourself if shit hits the fan in your life. Because it's a miracle that shit doesn't hit the fan every day. It's kind of crazy. And if you're one of those people, congratulations. But that's not a lot of people. And the weird systems that we put into place perpetuate people's bad circumstances. Yes, pills help people. Yes, all of this shit has a good chance of curing certain things. But there's a lot that just is not allowed on the table. And no one likes to be told what they can and cannot have or understand. Don't treat people like they're fucking stupid. Be transparent with them and give them a reason as to why things are not allowed for you. I don't know. Alright, kids, happy fucking whatever day it is. Sorry this is so long, too. Love you.